Hi, I am Dr. A P Nirmal Raj. I have done my specialty in prosthodontics and I am practicing at Premia Dental Care, which is at Nandi Durga Road. There are various steps that are involved when you need to make a crown on an implant. But we first begin with our diagnostic procedures. That is, you need to take proper x-rays, you need to make an OPG, and then you go forward with making a CBCT. The OPG which can give us an approximate rough idea about the height or the amount of bone that is available. But the width of the bone you will never be able to get unless you do a CBCT. So you need to do a scan to get the exact width of the bone. Only after you do all of this, you should go forward with going ahead placing an implant. So once you finish the diagnosis, you're ready with the CBCT, you're planned accordingly, the height of the implant, that is the length of the implant and the width of the implant. Then you go forward with your placement of the implant. You need to make sure that you take a good medical history before you go forward in placing the implant. You need to be aware of certain conditions like diabetes, wherein you need to know what is the HbA1c value. If the HbA1c value is above 8.5, I would say that you need to wait for some time, get it to 7.5 and then go forward in placing the implant. There are recommendations where you can say that you can go up to 10 also with HbA1c. But above 8.5 is something that I am not comfortable with. I would want my patient to come and reduce the values of sugar and then go forward with placing of the implant. So an implant is nothing but a minor surgical procedure wherein you have various drill sizes that are done. You drill the bone, either you can expose the bone or you can directly do it with the soft tissue. I prefer in exposing the bone and then placing the various drills according to whatever size that you have determined, the length you have determined, and you go forward and placing the various drill sizes and place the implant. Once you place the implant in position, you place what is known as the cover screw and then you suture it up and then you allow the implant to heal. So it is very important that if you are placing the implant and allowing it to heal, we do not have any forces that fall on the implant, at least for the first 45 days, which is very important. If you're doing an immediate loading, then it's a different question. But if not, you have to make sure that this 45 days, the implant is not loaded. Once it is not loaded, then you will take x-rays after your first week, then after your first month, and then after your second month, and you observe and see the amount of bone that is formed around the implant. Once you feel that the amount of bone that is formed around the implant is good, then you can go forward with your prosthodontic form of treatment. In the prosthodontic form of treatment, you have various steps too. The first thing that you place would be your healing abutment. You expose the implant, you remove the cover screw and you place the healing abutment. This healing abutment is placed so that you get a good gingival cuff or a collar. It looks like you get a good emergence profile also, like the crown is coming out from the gingiva. So that reason we place the gingival former. Once you place the gingival former, you allow it to stay for at least a minimum of 2 weeks or minimum 10 days. Once you get a good collar, then you go forward with making an impression for the implant. You have the open tray and the closed tray technique to make an impressions for an implant. Once you do that, then you go forward and do what is known as a jig trial. A jig trial is very important so that you know that your impression was right or wrong. So once you do a jig trial and if it is perfect, then you go forward making of the crown. You can either have it as a screw retained prosthesis or a cement retained prosthesis. I prefer more of a screw retained prosthesis than a cement retained prosthesis, but both of them are very successful form of treatment. So you can use any one of those two. And for anterior teeth, basically a cement retained produces more aesthetics compared to a screw retained prosthesis. So once you place them, then if you're placing a screw retained prosthesis, you tighten the screw to about 30 newtons and then once you do that, you cover it up with your tooth colored resin and send the patient home. Then you call the patient and just review in such a way and take an x-ray and see if everything is fine, the bone is fine, the occlusion is fine. If everything is fine, then ask the patient to come and review after every 6 months. So the review portion of the implant crown is very important. So you can call the patient after a month, then after 6 months, and at least once in a year, the patient should come for a review. Thank you.